What are the long-term health impacts of increased LDL cholesterol on a carnivore diet? Have you ever wondered what happens to your body when you follow a carnivore diet and your low-density lipoprotein cholesterol levels rise? Let's break it down. Low-density lipoprotein cholesterol is often referred to as bad cholesterol. When its levels increase over time, it can significantly impact heart health. On a carnivore diet, which mainly includes animal-based foods rich in saturated fat and cholesterol, it is common for low-density lipoprotein cholesterol levels to rise. This increase is linked to a higher risk of atherosclerosis. Atherosclerosis is a condition where plaque builds up in the arteries. This buildup can narrow blood vessels and potentially lead to serious issues like heart attacks and strokes. So, what causes this rise in low-density lipoprotein cholesterol on a carnivore diet? The high intake of saturated fats and dietary cholesterol from red meats and other animal products stimulates the liver. The liver produces more cholesterol and takes up less low-density lipoprotein from the blood. This results in higher levels of low-density lipoprotein circulating in the bloodstream. Additionally, fasting periods, which are often part of the carnivore or ketogenic lifestyle, can further elevate low-density lipoprotein cholesterol. This is due to increased fat metabolism and cholesterol production during these fasting times. Long-term elevated low-density lipoprotein cholesterol is a well-known risk factor for atherosclerotic cardiovascular disease. The risk is heightened by the absence of dietary fiber and plant-based nutrients in a carnivore diet. These nutrients usually help regulate cholesterol levels, reduce inflammation, and support overall vascular health. Without them, inflammation may increase, and blood pressure regulation can become impaired, further raising cardiovascular risk. However, some supporters of the carnivore diet argue that even with increased low-density lipoprotein cholesterol, other health markers may show improvement. For instance, high-density lipoprotein cholesterol, often called good cholesterol, and triglycerides might improve. Additionally, weight loss and better insulin sensitivity seen in some following this diet could help lower some cardiovascular risks. Still, it is important to remember that sustained high low-density lipoprotein cholesterol is a major contributor to heart disease. If you are following a carnivore diet and notice elevated low-density lipoprotein cholesterol levels, it is wise to keep an eye on other cardiovascular risk factors. These include blood pressure, inflammation markers, and your overall lipid profile. Consulting with healthcare providers for a thorough cardiovascular risk assessment is a smart move. Some individuals might consider regular testing and possibly adjusting their dietary choices or adding supplements to support heart health. Increased low-density lipoprotein cholesterol on a carnivore diet is associated with a higher risk of cardiovascular disease due to plaque buildup in arteries and the lack of protective nutrients from plants. While some health markers may show improvement, the long-term impact of elevated low-density lipoprotein cholesterol remains a significant concern for heart health.